My name is Jan Frank. I'm a professor of food biofunctionality from the University of Hohenheim in Stuttgart, Germany. And my personal interest in beer is actually more in hops and hops-related compounds. So I'm very much happy to look into the broader view into this session of the moderate alcohol consumption and not only the hop extracts from beer. And I'm very proud to present the first speaker, Dr. Henk Hendriks, who is a consultant and partner of the Nutrition Consultants Cooperative. He worked as a nutritionist in various institutes of the Dutch Organization for Applied Scientific Research, TNO, in the Netherlands for more than 28 years. His main expertise is in nutrition interventions that study the effects of nutrition on human health. And his more specific topics include moderate alcohol consumption and health, weight management, nutrigenomics, nutrition and coronary heart disease risk, functional food, health claims. You can see he's actually been working in a lot of different areas in the nutrition sciences. And apparently then also has published a lot, more than 130 scientific papers on these topics. And today his presentation is going to be about the impact of alcohol consumption on cancer risk, and we look very much forward to having you, Henk.
Good morning, ladies and gentlemen. Thank you, Mr. Chairman, for your kind introduction. Thank you, organizers, for inviting me to present some data on this important topic, alcohol consumption and cancer risk. First of all, what is cancer? Cancer is a collection of related diseases. We have about more than 100 different types of cancer. It's not one disease, it's a lot of different diseases. In all these types of cancers, the body cells begin to divide without stopping, and they spread into the surrounding tissue. So there's a destructive process. Cancer can start almost anywhere in the human body. And cancer is a multifactorial disease. That means that there is, apart from some monogenetic cancers, of course, there are usually a combination of factors that can be genetic and environmental. So it's a complicated cause to have cancer. Today I would like to say something about cancer deaths and incidences, cancer and its carcinogenicity, and how it's being categorized as carcinogenic. I would like to say something about risk factors. And then I would like to present some data we obtained after looking into the contribution of alcohol consumption to overall cancer risk. First, on incidence, cancer is a leading cause of death in the US. This is a slide from the US, and here you can see, I have to use the pointer here, yeah, okay. Heart disease, the main one, cancer, second, about 160, 70 people per 100,000 standard population, people dying of cancer, which is far more than other diseases like injuries, lung disease, stroke, Alzheimer's, diabetes, large diseases, but it's a major cause of death in the US. The data are here for 2015 and 2016. There seems to be a little decrease for both diseases. If you look at Europe, you can also see that both heart disease and cancer are the main causes of death. The other diseases are not in this slide, but the numbers are very high. That's why you can see it. And also interesting here is to see that in the EU, there seems to be a decline in the incidences of death due to heart disease and maybe a short leveling off of cancer in the EU. Back to the States. Here you can see this incidence, how it changes over time for cancer, the trends in cancer death rates by sex in the US over this period of time. And there you can see this trend of a decrease more clearly. Here you can see that both for men and for women, the rate per 100,000 is decreasing over time. And this has to do with better treatment, better diagnosis, and maybe possible also with a better prevention. Okay, so we make progress in the fight against cancer, at least in the States and probably also in the US. Now, cancer is not the same for men and women. I talked about 100 different types, and here you can see also the incidences over the same period of time from the same website or the same paper. And here you can see that men suffer more from prostate cancer than, for instance, from other cancers like lung cancer, colorectal cancer. Whereas women, the main cancer there is breast cancer. The most frequently occurring cancer is breast cancer. So there is a difference between genders for the different types of cancer. Okay. So alcohol is considered to be carcinogenic. And how is that? What is the story behind it being carcinogenic? In Europe, we have the International Agency for Research on Cancer. It's located in Europe. It's located in France, but it's a WHO institution which classifies agents for carcinogenicity. And their aim is to evaluate the evidence of carcinogenicity at any stage in the process, independent of the mechanisms. Yeah? And they call an agent carcinogenic if it's capable of increasing the incidence, so making more cases of cancer, when they reduce their latency, so they shorten the interval between having a factor and the occurrence of cancer, and it increases the severity. Then you call it carcinogenic. And IARC then, of course, goes and does a monograph. They collect all the evidence that's available on the issue, and they select agents for review based on two main criteria. The first one, obviously, is human exposure. The human has to be exposed to the compound, otherwise it's no use. And there must be some evidence or a suspicion of carcinogenicity. And when that's present, they put it on the list, and they make a monograph. And in the monograph, they describe the evidence that's available, and they conclude whether a compound is carcinogenic or not. This working group is a group of scientists within IARC, but also with specialists, representatives of national and international health agencies, and observers. And they work according to strict procedures, so it's not something which they do very lightly and quickly. It's a long-term procedure in which it's a very serious thing to do. And then they categorize basically the agents. And here is a slide of the agents that they have been looking into so far. I think that's data from last year or the year before. It's about 1,000 compounds, and they have group 1, 2, 3, and 4. And that is basically an important difference. Group 1 carcinogenics are compounds that are carcinogenic to humans. There is sufficient evidence they consider as carcinogenic to humans. In group 2, there's probably and possibly carcinogenic to humans, and that has to do with not the evidence in humans, but the evidence basically in animals. There is limited evidence for humans in this category, but in the probably carcinogenic class, there is sufficient evidence of carcinogenicity in animals, which is not the case in the 2B group. So there you have insufficient evidence in humans and less than sufficient evidence in animals. Group 4, group 3 is there is no evidence for carcinogenicity in humans. There's a lack of evidence in general for that group. That's a large group, 500 compounds, and there's only one compound for which there's sufficient evidence that it's not carcinogenic for humans, and that's the substance. I looked it up. It's caprolactam. It's a chemical precursor for nylon, and it's used in stretchy yoga pants and toothbrush bristles. So it's an odd one out maybe, but it's interesting to see there's a lot of compounds which are on the list but not classified, basically due to insufficient evidence. There's a rather large group of compounds that are probably carcinogenic, but still there's insufficient evidence in humans, and there is a considerable group of of compounds that are being considered carcinogenic. And of course, for alcohol consumption, I should say, not alcohol, but the consumption of alcoholic beverages is categorized in group 1, which is the most severe group. There is sufficient evidence to have a relation between alcohol drinking, alcohol consumption, and a number of specific cancers. These are oral cavity, pharynx, and larynx. Those are all located here in the area of the, how do you say, the neck. Esophagus, so from the mouth to the stomach, colorectum, liver, and the female breast. These are 7 types of cancers out of the more than 100 that are evaluated and considered to be positively related to alcohol consumption. So the risk of cancer, of this type of cancer, will increase if you consume alcohol. I would like to go through 2 examples of studies where you could look at. Usually they don't use single studies. They use meta-analyses, so huge studies as a summary of all studies available. But this is an example of the study that you see in that documentation. That's oral cavity cancer. So they took a study for about 500,000 participants in which they could detect about 800 cases of oral cavity. And they looked for both women and men for the exposure categories, the various exposure categories. And in non-drinkers, they could find 24 cases. In the less than 1 per day, 38, 15, and 9. And then you relate that to the number in the category. The control in this case was the less than 1 per day. You could also take maybe this group, the non-drinking, as the control group, but in this specific study they didn't. They thought to prevent confounding from this group, we take this group as the reference group, and therefore we put the relative risk at 1. Relative risk is just the risk where you compare it to the other groups. So this means that there is a relative large number of cancers in this consumption group of 1.7. There are less people in this group and less people in this group. And although the number of cases goes down, the relative risk increases. And you can calculate also a trend, a p-value as they call it. And it turns out to be a significant positive trend, an increasing trend with alcohol consumption. And therefore they consider, and it's also observed not only in women, also in men, you can see an increase in this risk. And this is the kind of study that they use to assess the carcinogenicity of alcohol in specific cancers. However, if you look at a different kind of cancer, for instance lung cancer, the story is a little bit different. It's also a different type of study. In lung cancer, of course, there's a huge influence of smoking. And that's why I picked this study as an example, because this study has been done in non-smokers or never smokers, actually. So smoking is not an issue. It's not being corrected for. People just didn't smoke. And here you can see that when you compare those that do not get lung cancer and those that do get lung cancer, large groups, that the number of cases sort of decreases when you compare it to the non-drinking category. Here, half a glass, at least in Europe, up to 1 glass in Europe. The numbers go down, and you can see that the relative risk of compared to the control group is 0.8, stays at 0.8, and goes up at very high consumptions. So the story is a little bit complicated in the sense that alcohol is carcinogenic. Yes, alcohol consumption stimulates some cancers, 6 out of 7, but it may also have a beneficial effect on some other cancers. Sorry. And to make it a little bit more complex, we have to talk about risk factors, because, as I mentioned, it's a multifactorial disease. It's not only alcohol that determines cancer. There's actually a lot of factors, known risk factors for cancer. And this is in alphabetical order. Aging, alcohol, chronic inflammation, diet. Some of them we can influence, and others we cannot influence. Here you can see a picture of the American Association for Cancer Research, and here they listed these risk factors and their contribution to the cancer incidence. And that's a relative contribution. Here you can see the relative contribution to cancer incidence. And far out, the most important lifestyle factor, preventable factors we are talking about now, is smoking. About or more than 30% of the cancers that are preventable have to do with smoking. Overweight, also a very important risk factor, about 20%. Then we have a smaller group of pathogens, viruses, that kind of thing, bacteria, contributing for about 15%. Then there's a larger group, let's say, of unknowns, physical inactivity, diet, occupational exposures of about 5% each. These are smaller groups. And then you got still smaller groups, and that's alcohol, reproductive factors, and then still those contribute very little, let's say a few percent. So from this slide it's already clear that alcohol is a factor, a risk factor for cancer, of course, cancer incidence, and it's of course preventable, and therefore there's focus on alcohol, but it's not a major one, at least according to this slide. For instance, let's go to breast cancer. I would like to use it as an example, because breast cancer is the most frequently occurring cancer in women, and there's a lot of different risk factors that contribute to your breast cancer risk. Getting older, genetic mutations, early menstrual period, starting menopause after age 55, late or no pregnancy. Some of them you can influence, but most of them you cannot. You can say maybe decide to have kids a little bit later, but I think it's not really something you can change or manipulate to prevent cancer incidence. Basically, there are only 3 of them: not being physically active, being overweight or obese, and drinking alcohol. And I think that's the reason why there's so much attention for alcohol drinking and breast cancer, because it's only one of the many that can be changed to have some preventive effect. And what they say for breast cancer is there's 10% more risk for getting breast cancer with every glass you drink per day. You drink more. And then you have to remember that this is a relative risk. The normal risk for a woman is 12.5%. 1 in 8 women gets breast cancer. And then the relative risk is 10%, which means with every glass you get 10% more risk, which is not 12.5 plus 10, but it's 12.5 plus 10% of 12.5. So it's 12.5 when you do not drink, and it's 13 to 14 when you do drink 1 glass a day. Yeah? So the relative risk is a very difficult concept, and you should really be aware that it's related to other risks. Okay. Then the alcohol's contribution to overall cancer risk. I showed you the slide before of the American Society, but what we did, we tried to look at the the relevance of the alcohol dose over the overall cancer risk. And then we looked at the 20 most frequently occurring cancers, and they all accounted for more than 80% of the cancers that are available. So we would like to estimate the level of alcohol consumption that is important for the risk distribution, and we would like to estimate that for both men and women. So we went to the literature, we obtained lots of articles, and we focused on meta-analyses. And meta-analyses are compilations of studies, statistical compilations of studies. And we focused on the Western world because cancer incidence is different in the Far East. And we took the most recent ones and the largest ones, and the ones that would have the right categorization of alcohol consumption, because it's highly variable in studies. And we sort of compiled those studies and those things. And I won't show you this model because we looked at differences between men and women, but I won't show you the model because of time. These are the 20 cancer types we looked at for both men and women. And you see number 1, breast cancer, very important for women. There's a large contribution of the cancers that women get. 40%, almost 40% is breast cancer. These are data from the European database on cancer. Prostate cancer is, of course, important in men. Women don't have a prostate. Colorectal cancer, lung cancer, and then it drops down to lower percentages. And if we calculated the distribution of those 20 up to 100%, and that's what we looked at those 20. So they totally account in total for about 80% of all cancer incidences. And how does that really work? Because we have relative risks, as I told you. For instance, in men, top 5 cancers. Breast cancer doesn't exist in men. It does exist, but it's very rare. But the issue here is that we relate the alcohol consumption level to the risk. And here you can see that the control group, 0 to 2.5 grams of alcohol per day, quarter of a glass, does not increase the risk of breast cancer in men, of course, because there is no risk, basically. Prostate cancer is a different story. Yeah? You have the relative risk of 1, but you can relate the risk of the other drinking categories. It doesn't really make a lot of difference with prostate cancer. It increases a little bit, but not much. Colorectal cancer, that's also being recognized as being related to alcohol consumption. Here you can see that the risk increases 6%, 13, 27, and so forth. So that's the way we did it for all the different cancers, and then we basically multiplied it. I switched the order of the slides, which I shouldn't have. Then you have to sort of look at the risk contribution of those cancers. As I told you, breast cancer doesn't occur in men, so there's no contribution of breast cancer in none of the categories. Prostate cancer, there's a lot of prostate cancer in men, large contribution, and then when you multiply that with the relative risk, the contribution increases. Same thing for colorectal cancer, lung cancer, as I showed, it's going down a little bit. And then you can add these all up so that you can come to the total of which you should come to 1 again, because you have the contribution times the relative risks. And you can see that we came almost a little bit over 1, and here almost at 1 for men and women. But what's the important thing in this slide is that we can relate the cancer risk from with alcohol consumption, the amount of alcohol that you consume. And you can see for men, it's 1 in the control group, if you do not drink or drink lightly. When you drink up to 1.5 glass per day, or 1 American glass, I would say, it's still 1. It's a little bit lower, but let's say 1. Here it goes maybe a little bit up. I didn't do statistics on these numbers, so I cannot say whether it's significant, but yeah, maybe a small increase of 3%, and then you go to higher consumptions like 3 to 6 glasses a day, then you go to up to 5%, and here above 60 grams, it's up to 20%. For women, a very similar story, although women seems to be a little bit more sensitive again. It looks like that for women, the increase here in this category is somewhat larger, and also increase in larger amounts. So I thought that was an interesting exercise to see how alcohol and the amount of alcohol contributes to cancer. And that's basically what I would like to show you, that cancer is a leading cause of death in the Western world, that alcohol consumption is one of the many risk factors, and associated with, positively associated, I would say, with a limited number of cancers. That moderate alcohol consumption, here defined as up to 15 grams per day, may not be positively associated with overall cancer incidence, and therefore does not contribute to overall cancer risk, and that higher consumptions, over 15 grams per day, is associated with an overall increased cancer risk of about 3 to 8% in the 15 to 30 grams category, and the 5 to 10%, the lower numbers are for the men and the higher numbers are for the women, 10% in the 30 to 60 grams per day. But the real increases are in the above 60 grams per day category. Okay, thank you for your attention.
Thank you very much. And I'm going to let you know that we're not going to do a Q&A session, but we actually give you the chance to ask questions now. directly after the talk, so please go ahead.
Mike.
Yep.
Yeah.
I can move.
Okay.
The figures for high alcohol consumption and causation of cancer, was smoking accounted for in that group?
No.
Because we know that people who have high alcohol intake are more often heavy smokers.
Yeah, true.
So is that accounted for in the statistics?
In all epidemiological studies, people correct for other confounding factors, and smoking is always one of them, like physical activity, obesity, all those other factors are corrected for. Yeah, so in principle it should not play a role.
I think, Ramon? Ascension? Ladies first.
Ladies first.
Thank you so much. Very kind of you. Well, it's a very interesting talk, so thank you so much. But I was surprised you didn't say anything about the stress situations and what happens also with mental disorders, because they were not among the factors.
No. Yeah,
Why?
correct.
Because sometimes, because of stress situation,
Yeah.
a cancer comes up.
No, it's not on the slide of the American Association, and I'm not familiar with the literature on stress and cancer. It may be a very interesting factor to look into, but I'm not sure whether this is really. It may be very difficult to quantify and to categorize, but maybe you can say more.
Novel issue, stress and the effect on health. So now we haven't a recent study that is investigating this topic. Maybe in the coming year we found a new cohort study that show important results or effect of stress on cancer, disease, and total mortality.
Okay.
Yeah, I think that we need to do more research.
Yes.
So that's why we need more funding.
That's always true.
Thank you, Henk, for the lecture. I always ask the same question. Do you think it's different, the effects of the fermented beverage like wine and beer versus spirits on cancer?
Yeah.
And the second question is, I believe that the effect depends of the diet in which you consume the alcohol. So in a Mediterranean diet, I think the fermented beverage protect against cancer, and in Western diet, induce cancer. Have you analyzed this, or what are you thinking about this?
I didn't analyze it, unfortunately, and it's always very difficult to look at differences in beverages, because people usually don't drink one beverage. They sometimes drink a beer, sometimes drink wine. So it's really difficult, I think, to disconnect those. But I think there may be a positive effect of fermented beverages. I mean, the first studies coming out on cancer from the States and from France, they showed a J-curve with alcohol consumption, showing that wine would have a reduced incidence of cancer mortality. So that was overall cancer mortality in that case. Now this is more split up of the different kinds, but in general, these 20 kinds, it's very difficult to find reviews that split up for different beverages. Yeah.
Thank you.
I think there's one question right behind.
Is there any study looking also to the, I would say, alcohol career of people?
Yeah.
So like in some lives they drink a lot when they are young, and then they stop drinking, and then they start again when they're getting old. Other ones are starting drinking a little, then drinking more, get addicted, and drink and drink and drink. And so it's other studies who also look at this. Maybe it's a late risk if you drink much in your youth, or with addicted persons, what happens to their bodies?
No, I don't think there's a lot of studies that look at drinking career. Usually in epidemiological studies, as far as I know, they check what you drink and what you eat. And at the best, every 4 years, I would say. Sometimes it's not even that. So, and then they average it out usually. The pattern analysis is also new and will be coming up, I'm sure, because it will make a difference. Yeah.
Actually, I do have another question.
Okay.
And one that's very basic. What is the mechanisms by which alcohol actually induces cancer? And then that leads me to the follow-up question, which is, how can that explain perhaps that if you don't drink alcohol, you have a somewhat higher risk even, or it doesn't protect you if you don't drink?
Well, the mechanism, people say that the mechanism is known of alcohol and cancer. I'm not convinced of that, to be honest. Alcohol itself is being metabolized into acetaldehyde, and acetaldehyde is a very reactive compound. So when you have parts of your body where you have high exposure, like in the mouth and here in your throat, it could very well be that there's a relatively high concentrations of acetaldehyde, which can cause cancer. But it doesn't really fit with some of the other types of cancers, like breast cancer. I think by the time the alcohol gets to the breast, I think it's diluted, and it's probably not the same mechanism, and that's also what they propose. In breast cancer, they say, okay, it may be a hormonal change that is due to this breast cancer incidence increase. So I think there's not one mechanism to be clear. There may be many mechanisms because they're all different diseases, of course. And in that sense, we don't know exactly how everything comes about. I mean, liver cancer occurs in the very high consumption levels. Is that the alcohol, or is this the general poisoning of the person? So that's a bit, it's still out, that question. And the follow-up question, if you don't drink, are you protect us? Why is it protected?
No, why isn't it? Because I mean, if you look at your data, it looks like not drinking isn't better than drinking a little bit.
No, that's true.
So why doesn't leaving the poison out? Why doesn't that help us?
Well, because I think one of the reasons is that we are very well adapted of dealing with this poison. I mean, if you drink, if we drink together in the bar, let's say we drink 2 or 3 beers. That's about 30 grams of alcohol. That's a huge amount of poison. And you cannot deal with such huge amounts of poisons in other cases. So we have been adapted evolutionary to this, to deal with the alcohol. And we have a good enzyme system, and we can easily drink 2 or 3 beers. Yeah?
Thank you very much.
Yeah.
One last question before we move on.
Coffee is known to have several carcinogens in it, right?
Yeah.
And yet, most epidemiological evidence show that a cup or 2 a day, or 12, you know, I don't drink that much, but a cup or 2 is decently healthy for you.
Yeah.
There seems to be some sort of paradox here, right, where small amounts of these toxins actually have the opposite effect of what we would predict, yeah?
Well, I don't think it's a paradox because I'm a biologist. And of course, you know, there's always an optimum. And I think our system has been geared to an optimum. If you don't eat, you'll die. If you eat too much, you get obesity. So there's always a balance between the good effects and the bad effects. So in that sense, no, I'm not surprised. I'm very much in favor of the J-curve. And I think it's true for many relations. Yeah.